So since I'm an overly punctual person, I am going to get started. I'm going to take this off. Scott's going to stay back there, so don't worry. Hi, my name is Melissa Luety. I'm the clinic director here at React Physical Therapy, Lincoln Park. It will be a little webinar here on spinal mobility. We're going to go over a bunch of stretches, some active releases, and then some active mobility drills. I know that we're all feeling a bit stiff and a bit crunched with the cold coming on and work from home and COVID. There's a lot of restrictions in our lives. So here's some opportunity to just sort of work through a lot of things in a lot of different ways. This over here, this is Scott Nelson. He is my graduate student right now. He's with React for his 12-week clinical. He's at University of Illinois at Chicago. I should remember that. I went there. So he is helping out as a demo and has helped us with some of the slides too. A couple of things I want to just let people know just about React in the meantime is we are offering telehealth. I said that before we officially started, but if anybody is looking to come in or get treatment but doesn't feel comfortable coming to the clinic, that's always an option. I'd like to remind everyone that Illinois is a direct access state, so you don't have to have a prescription from a doctor to come in. You can just come in and we can get treatment started, and we can figure things out from there. And we always do free screens. So if anyone has a question about an injury or pain or performance or anything that you might have on your mind, feel free to give us a call and just come in at any time. So, okay, so I'm gonna share my screen here, and Scott's gonna do a weird mask roll-up trade-off situation. So, and I'm gonna try to check in with your questions, but it might have to be after I share this because the share screen takes up really my whole screen. So, okay, Scott, take it away.
Hey. Hi, everybody. So today, as you can see from the title, we're going to be talking about how do we improve our spinal mobility for pain and performance. A lot of stuff that we should be going over, like she was saying, in a time like this. So to get started, we're going to talk about the spine, since that's kind of the meat and bones of our conversation today. So different parts of the spine. So as you can see from the image, we have three main parts we're going to talk about: the cervical spine, which is also the neck, the mid-back in the yellow, which is our thoracic spine, and then the low back in purple there is called the lumbar spine. And then just below that, we have the sacrum and the coccyx. That's kind of like right around our pelvis and where our hips come and connect with our trunk. That's what we consider our tailbone. So why is spine mobility important? So kind of just three primary things about the spine. So first of all, it provides the foundation for posture. If our spine is in certain positions, it kind of dictates where we are in space. If we're really slumped over and our spine is flexed forward, we find ourselves in this like forward sit position. Secondly, it provides the foundation for mobility. So a lot of the muscles attached to the spine in this area, and it can also help to dictate movement. So if our spine moves well, our arms and our legs also can move well. So breaking up the different motions of the spine. So in the image in the top left, you can see the first one is flexion. So that's bending forward like you're touching your toes. The second one is extension, also in the top left photo there. That's bending backwards like we're looking up towards the ceiling. Top right, we have lateral flexion or side bending. That's if you're staying facing forward, you just kind of drop down to one side or the other. And then finally, we have rotation in that bottom image there to both directions. That could be looking over your shoulders or crossing the street, stuff like that. Today, we're really going to focus on both extension and rotation because a lot of times we find ourselves in this flexed posture, this rounded shoulders posture. So we really want to work on different ways that you guys can kind of open up our chest, bring our shoulders back, and kind of work against this position that we find ourselves in for many hours throughout the day. So what is proper spinal mobility? It's the ability to achieve the appropriate amount of movement between all of the different segments that we talked about. So the cervical, thoracic, and lumbar spine during daily activities. So when we need to reach into a cabinet up overhead, or we need to turn and reach something in the backseat of the car, are we able to use all parts of our spine in order to get to those different positions? And then the second part there is our bodies like to take the path of least resistance. So our bodies are great machines and they can adapt when they need to. But sometimes if we have a lack of mobility, like we'll get into in a little bit. What that can lead to is compensation. So other areas around that part like to work extra hard in order to make up for that lack of mobility so that we can keep doing those things we're doing every day. The problem with that is sometimes the tissues that are moving too much or the joints, they end up with that repetitive overuse, getting injured, and sometimes that's when we can get into trouble. So when we're sitting, why is mobility of the spine important? So a lot of us are probably experiencing this right now, working from home or doing a lot of work at home, or any of our students or office workers that are here with us today. When we're sitting in extended periods of time, 8-10 hours a day even, there's a high association with mobility loss in a lot of different areas of the spine that we're going to break up now. So first of all, in the neck or the cervical spine, a lot of times what can happen is when we're sitting at a computer, the computer is either too low or it's too far away, so our eyes are kind of straining, so we sit forward and flex forward like this. The forward head posture, our heads are pretty heavy, so it requires the muscles in the back of the neck and the front to work extra hard to hold the head up. And a lot of times this overworking of those muscles and positioning and a few other things can cause things like headaches, both neck and shoulder pain, jaw pain, and just overall stiffness in the upper back and neck. And then we get into the thoracic spine, so that mid-back area. Same idea. All these movements are kind of coupled together, like you'll see in a second. So if we're slouching forward, our shoulders are rounded forward, and again, we're in this forward head posture, that can lead to a lot of stiffness in the upper back, as well as neck and shoulder pain again. And then the low back, so again, in this slumped posture, it can lead to rounding in the low back, as well as something we're going to talk about in a little bit with our demonstrations. Our pelvis actually tilts backwards, so we like slouch down like this. And that can lead to, again, another list of problems, anything from disc issues to just general low back pain and hip pain. So now with movement, why is mobility important? So this isn't, we have here athletes and weekend warriors, but this is really movement just in general as you're going throughout the day. Any kind of rotational movements, so specifically for any kind of athletics or things you're doing throughout the day, like shoveling or like we talked about, rotating. So if we have the right amount of mobility in our thoracic spine, specifically that mid-back area, it allows for any force that we create in our legs or our hips to transfer up through our shoulders and our arms so that we can do whatever we need to do. So whether that's throwing a football or a baseball or swinging a golf club, a lot of times if we have a hitch in the step there and we don't have the movement we need, we create the force in the hips and the legs, and then we kind of lose it halfway through and we have to recreate it with our arms. And a lot of times that's when we can get into trouble again with shoulder injuries or neck injuries. Secondly, we have overhead movements. So this could be anything from if you're a lifter, heavyweight lifter, or you're just lifting a stack of plates over your head into the cabinet, as well as catching or just any other overhead activity. If you have the right amount of thoracic spine mobility, it allows for you to get your arms fully overhead. So if we're slouched over like this, we can't quite get our arms as high as we need to, versus if we sit up nice and tall, we can get those last few degrees that are really going to help us. So we're just going to quickly list some of the muscles that we're going to target today with our movement. But what we really want to work on is getting the muscles and the other soft tissues relaxed and released before we try to move the spine. So the reason for this is if we try to move the spine, but the muscles aren't really allowing us to move because they're kind of holding on and they're tight, then we're kind of fighting against ourselves. So what we want to do is get the muscles to relax, get everything to play nicely, and then we can move the spine and kind of keep that new position. So the first two muscles here, the Latissimus Dorsi, it's the big muscle that kind of runs along our back and up along here. If it's tight, it can limit overhead movement. The pectoralis major is the big muscle right here in the front, and that can kind of lead to that slouched shoulder position if it's tight and not really moving very well. The next slide we have here is Levator, Scapulae, and upper Trapezius. So those kind of live right in this area between the neck and the shoulder. Same kind of thing with that forward head posture. Those muscles really have to hold on for dear life to keep our head upright. So a lot of times they're overworking, and it can lead to things like increased stiffness in the area just to protect it, as well as some shoulder neck pain. And then on this final slide, the first two are kind of in like the lower or like the leg area and the lower abdomen area. So the quadriceps help to move the knee, straighten the knee out, as well as bring the knee up to the chest, which is what the psoas does as well. It brings the knee up to the chest. And if we're sitting all day, those muscles are shortened. And if we try to stand up and they don't want to lengthen out, a lot of times we have that arched low back that we'll talk about again later. And that can lead to a lot of different pain issues in the hip and the low back and the knee. And then finally, Quadratus Lumborum, that's another muscle in our back, found on both sides. And if that's stiff or overworking, we can have limited mobility bending forward or going to the side. And you can just feel that general stiffness in the low back. I'm going to pass it off to Missy now.
Okay, while Scott gets ready to demonstrate some of these, I am going to sort of awkwardly lurk in the front here. What we're gonna do is we're gonna show you 3 self-releases. One is for the chest, one is for about the rib cage, the shoulders, and the mid-back. One is to open up the front of the hips. And then we're gonna do a couple of stretches. One will be a hip flexor stretch, one will be a pec stretch in the doorway, one will be a side body stretch, and one is a neck stretch. We're gonna try to go through these in sort of a stretching order that allows for the least amount of positional changes. I don't like people having to like flop all over the place. So let's go through these. Let me stop this really quick so you can see it more. There we go. Check to see if anybody has any questions. Nope, doing good so far. Okay, so the first one that we're gonna do is the pec release. So for the pec release, you're gonna take the lacrosse ball. I don't know if you guys have these. You can use a tennis ball, you could use a baseball. Lacrosse balls are about $5 at the Dick's Sports or Amazon, everything. So what we're gonna do is we're gonna find the pec, which is usually the front of your shoulder bone, and then drop down just a little bit. And Scott's gonna put that lacrosse ball there. Anytime we do an active release to a muscle, we try to move the limb in the direction that the muscle works. So for the pec release, he's gonna flex his arm up and down. So you're really gonna pin that pec and then flex up and down. Obviously, many people won't have a rack like this at home, but you can just do it on the edge of a doorway. Just make sure your arm is opening up into the middle of the doorway rather than jamming into it. And then the second motion you can do is more of almost like a bench press position. So you're gonna horizontally abduct the arm back and forth. Some of these are gonna feel better for certain people and worse for certain people. I don't ever want you going into a painful motion just to make sure that you're getting you want the deep tissue release, but not pain in that actual joint. The next one we're gonna do is on the ground. So we'll do a couple of things on the ground. So we're gonna get down there, we're gonna get the foam roller out. We're gonna be working again on this sort of back of shoulder and lat area. So I like to tell people, if you were to put your finger in your armpit and wrap your fingers around, that's kind of where you start with your foam roller. So you get here, and then you're gonna rotate your arm in and out. So Scott will sort of rotate in and out. That will get a little bit of that posterior cuff. The posterior cuff is a rotator cuff. It's super important for shoulder function, scapular mobility, upper back mobility. And then we can also kind of do like a little punching up and down motion. That kind of starts getting into the lats a bit more. And then as we free up those tissues, we're just gonna roll up it a little bit so that we get really more into the lats. We start getting into some of that fascia that's along the rib cage, open up our rib mobility, start to get into that mid-back area. The lat is a huge muscle that does a ton of motion, so you really need quite a bit of length through there. The next one we're gonna do is the front of the thighs. Like Scott said, the quads and the hip flexors are both like really intrinsically linked to spine function, spine mobility. So this is many of my patients' least favorite release, but you're gonna get all the way down on the foam roller. And you can sort of try to modify your weight-bearing position based on where your arms are. You can either lie flat on your belly, so your chest is on the ground. That gives you a little bit more support if you have painful shoulders, or you can prop yourself up in your arms, take a little bit of body weight off. Sometimes people even like to stack up a couple of pillows underneath their chest, because if you get a tight spot in those quads, you're gonna feel it. So what we do with the active portion of the release is we just kick the leg up and down. Again, that's what the quads do, so we're gonna do that function. We're looking for basically tight spots in the muscles. This will be pretty easy for you to identify. You'll be like, oh, this isn't so bad, and then you'll roll over a spot and all of a sudden, wham, you're really gonna feel it. Another thing to keep in mind is that the quads have different heads. So there are an outer quad, you can sort of roll out to the outside of your body for this. And then there's the inner quads, which are a little bit closer to the knee. They really connect quite closely with the inner thigh muscles, the groin muscles. So they have a lot to do with pelvic stability. So roll around a little bit, find those tender areas, work them out. So the next we're going to move on to stretching. So the first thing we're going to do, actually, Scott, let's do the pec stretch first. We'll do the head stretch last. So we'll go in sort of the same order. So we're going to do a pec stretch. We're going to do it on the rack only because it's right there and Scott's a little tall for that doorway. If you have a doorway at home, you can totally do this in the doorway instead of on the rack. So for this, you're literally going to put your elbow and your palm right against the doorway, and then you're just going to lean your body forward into that. You're trying to get a really nice stretch to the whole front of that shoulder, but you shouldn't feel a lot of pain or pinching in the front of the shoulder or in the back of the shoulder. If you do, I want you to just modify your arm position, maybe bring it down a little bit, maybe straighten the arm out this way. If you have a relatively narrow doorway, you can do both arms at the same time. We just don't have that here. Actually, all of our doorways are freakishly wide, so no one can reach them. The next one we're going to do is a side body stretch. So he's going to set himself up at the rack, and you can do this again on the doorway. You're going to cross your outer leg over the inner leg. In this, we're going to get into IT band, we're going to get into TFL, we're going to get to the lat, and we're going to get into the QL. It's a whole lot for once. You're going to reach your arm all the way up overhead, and then try to hold on to the doorway here. So one thing that I often correct on people is people do a lot of crazy rotation with this. Try to make sure that you're really trying to get your body like you're sandwiched in between two planes of glass, okay? And then you can either just lean your hips out this direction for a nice side bend stretch, which is really great. Or sometimes I like to really like almost push my hand into the doorway to push out and around. And again, no pain, no pinching. If you have problems with your shoulder pinching during this, just reach up a little bit high, move a little closer to the doorway, reach up a little higher, give yourself a little bit of freedom in that joint. The next one we'll do is the hip flexor stretch. Kind of awkward to narrate this while he's behind me because I have to like do a weird mirror pointing. I don't really know what's happening here. So in the half kneeling hip flexor stretch, one thing that's really important is that this is not yet a lumbar extension. So one thing we need to think about is that when we're doing this half kneeling hip flexor stretch, we are in a 90-90 position, and then he's going to tuck his tailbone under to get into the hip flexors and just lean his butt forward. So as he pushes forward this way, he'll feel that in the front of his hip and maybe the top of his quad, but he won't be leaning back a lot. He won't be doing like a big arching extension. We will get into spinal extension later. This is really just to prep the hips to open to get us to that position. And the last one that we have is a seated one. I think I'm gonna move us over this way a little bit. It's for just the upper trap and the necks. So an upper trap stretch is obviously just bending your head over like this. The upper traps, like we said, are sort of in the side of your neck here. But what we like to do is we like to pin our hand down to the side of our chair. The reason we do this is because then we can lean our bodies away from our hand. So we're already depressing that shoulder girdle. So now we're getting some nice stretch through the neck without having to crank into the neck yet. So already like this, he probably feels quite a bit of stretch on the outside of the neck. But to add a little overpressure, you're going to add your hand on top of the head and just follow that lean away. But you can see how depressing that shoulder like really keeps you from having just straight cranking into the neck, which is kind of what we're trying to avoid in all of this. Okay, any questions? I don't see any little hands raised or anything like that, so that's a good thing. Okay, so now we're gonna get into some active spinal mobility. I might have to move out of the way for this one. Again, we wanted to set this up so that we could get you guys in a good position to do this all in one clump. I had one pre-question that was, what are some things that I can do in bed before I get out of bed? I'm really stiff in the morning. Some of these are a great way to do this. All of these will be either mat or floor work, but you could also do them in bed. One piece of advice I usually give patients though, if you're doing mobility stretches, lumbar, cervical, really any of the spinal mobility stretches first thing in the morning, be aware that you're going to be a bit stiffer than you would in the end of the day. So don't try to crank yourself into end range. If you're doing it first thing in the morning, you're just doing like easy warm-up stretches, and then you're going to try to get the rest of that mobility later on in the day. You can maybe go into some deeper stretches. Okay, so the first thing we're going to do is just a global spine mobility. Scott's going to get on all four of us, and we're just going to demonstrate the cat-cow. This is a super common yoga pose. I do a lot of yoga, so I'm gonna refer to that a lot. Yoga pose. One thing that we do a little bit differently when we're thinking about spinal mobility is I do like to get a bit more active muscle. So I always ask my patients to start with the pelvis and sort of tuck the tailbone underneath first as you start arching into it. So you tuck the tailbone under and then press up through the mid back and then tuck the head under. There you go. And that really makes sure that you get the whole spine into it. If we don't do that, okay, untuck, arch through the low back, arch through the mid spine, and look up. If we don't do that, the vast majority of us end up doing a cat-cow really just in our upper back. We really don't get the low back into it. So I like to emphasize getting that pelvic tuck to sort of drive that full spinal flexion. It's also a great way to get your low abs working, first thing in the morning too. Okay, the second one we're gonna get into is we're gonna start doing some, oh, hi Jim. We're gonna start doing some extension. So there's two options here. We're gonna do one with a foam roller and then one at the bench. So first we'll do the foam roller. This extension is really more for the mid back. Although as we get into lower angles, we'll get a little bit of lumbar mobility here as well. So he's gonna position this perpendicular, I always forgot the word parallel, perpendicular to his spine here. And then you're gonna lock your hands over your head and you're really going to pinch your elbows together with your hands behind your neck. The reason I like that is because then when you start extending this way, you've kind of gotten your neck out of the position. So you're really focusing this on the mid back as you go up and over. So in all of these, I tell people 10, 15, 20 times. Each time you're going to be moving that foam roller sort of up and down the back, trying to find areas that feel a little tighter for you, that feel a little bit more restricted. You're trying to, ultimately, all of us are asymmetrical. Our spine is going to be stiffer in some areas than the next person. So spend a little bit extra time, give your body a little bit of extra love there. The next one, it's a very similar stretch, but we're going to do it at the bench. The nice thing about this is you can do it at a bench, you can do it at your kitchen table, you can do it at your desk while you're working. You can literally pop down like this to do this. But we're going to get in a similar position and then our elbows will go on the bench. Same thing with our hands behind our head. And then he's just gonna actually sit back into his hips. There you go. You can see right here that his upper back just gets that nice arch. There's kind of two options in this stretch. You can either do the same as we did with the extension on the foam roller and keep your elbows nice and close. That really gets it into the mid back. Or else you can keep your arms a little bit wider, and that will do a little bit of more stretching, sort of reinforcing that lat stretch that we did earlier, that lat foam rolling we did. And this is really if your neck isn't bothering you in that position too much. Okay, next we're gonna move into rotation. So for rotation, we're first gonna do the open books. This is one of my favorite exercises. I just think this feels like so delightful. So we'll lay on our side. We like to have a pillow or a foam roller or something like that under our head, just in case it doesn't put our neck in a weird side bending position. So our hips and our knees are stacked, our feet are stacked, and then they're gonna stay that way because we're trying to drive this from the top down. So as Scott opens his arms up, he will follow his hand with his eyes. So his cervical spine moves with his thoracic spine, and then he'll come back in. So as you can see, even on that one, he rolled back in the hips a little bit. That's pretty normal, but we're just trying to reinforce not like fully opening up, because then you can get from the top down a little bit better. Sometimes people are really stuck in this position and they're like, oh my gosh, my hand is nowhere near the ground in this. Sometimes what I tell people is get here, right? Now take a really deep breath, really big breath into the chest, and then let it out again. Sort of let your breathing take you a little bit deeper into this bit of mobility. Another thing to note is many people are very asymmetrical. This will be very easy on one side and very challenging on the other side. So that's totally okay. That's normal. Use your breath to get into it. Let yourself relax into this position. Again, 10, 15 times on each side. Okay, the next one we're gonna get into is the prone press up. So we'll do prone press ups. If anybody has ever had like a disc problem or back pain, you've probably done this at some point. In yoga, we do a couple of different versions of this. We do a yoga, we do a cobra, we do a chaturanga, up dog, all those sorts of things. But are you checking the time? Am I talking too much? I think he's saying I talk too much. Kids these days. Anyway, so to get into the prone press up, the first thing you're going to do is put your hands directly underneath your shoulders, and then you're going to press your arms straight. This can be a little hard because it does require a lot of arm strength. And really, the difference between this and when we would do like a cobra in yoga is for the prone press up, we're really going to try to keep our hips and our legs very loose and relaxed during it. That way we really get into the low back more. If sometimes people will report that they get a little bit of cracking or popping or snapping. So what I would say is start maybe in a smaller range of motion. So come just do little prone press ups and see if maybe you can work into it before you get all the way into that full range. When it comes to, people ask me this question a lot about popping, cracking, particularly in the spine. It's very normal that in some of these rotations, you're going to get a little bit of cavitation in the spine, and that's pretty normal. If it's the same snap every single time, then maybe you just adjust your arm position, your hand position a little bit, your hip position a little bit, and see if you can clear that up. And also, if it's not, this is always a tricky answer, but if you're hearing some clicking, popping, snapping, and it's not painful and it's not getting worse, then keep an eye on it, take note of it, listen to your body, and then we'll come back to that later. Okay, the next one we have is the supine twist. This is a great example of a lot of clicking, popping sort of situation. This supine twist, people always get a lot of sort of cracking in the back. So lay flat on your back first, bend your knee and hip up to about 90 degrees, and then drop that over to the body. There you go. So this is a pretty deep twist. And this is one where I'm actually not telling you to do lots of repetitions. This is when we're going to kind of relax in this position and inch our way into it. So Scott's going to take some deep breaths that will help kind of let his spine open up. You get some space in there as you breathe in, and then you open up some space as you breathe out. Another thing you can do once that feels a little easier, let me move this towards him a little bit more, is shimmy your arm in this direction towards me. So that will help him get a little bit more through the upper back. And then the other option is your bottom hip shifted away from me. So tuck your bottom hip underneath you a little bit more. That'll help bring your knee forward. Some people like to put their hand on their knee, just kind of like hold themselves there. But I like to do this stretch in a position where it really is pretty much as passive as possible. So you're sort of letting your body get into it where you can. Very often I have patients that are very stiff doing this position, and we will put the leg on a foam roll, or we'll prop their arm, this arm up on a like a yoga block. So give yourself a position where you're not like, everything is not fighting against you, and you'll find that it's a bit easier to kind of get into that position. Okay, the next one we're going to do. Okay, does anyone have any questions? It seems as though I answered your back popping, no pain questions. 4 releases were pec, lat, quad. No, there's only 3 releases. The question was, what are the 4 releases? We did 3 releases, so I feel like this is a pop quiz. Okay, so the next one we're going to do is we're going to do some seated stuff. This is great for people that are at a desk because you don't have to get on the floor. Work from home, we can kind of do whatever we want, but if you're at an office, it's a little strange to get down on the floor. So the first thing that we're going to do is just pelvic tilts. So Scott had touched on this before, where often if we're sitting at a desk for a long period of time, we get this slouchy position. The slouchy position, our tailbone is tucked under, there's a lot of stress on our disc, really hard on our low back, our thoracic spine is rounded, our arms are crunched, our head is sticking forward. Nobody likes that. So what we do is a pelvic tilt. I often call it a slouch correct because it's easier for people to remember that, because really what we're going to do is we're going to slouch all the way, tuck that tailbone under, roll, 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 and then we're going to correct it. So we're going to stick our tailbone out like we had a tail. We're really going to arch our back. We're going to extend through the thoracic spine, and we're going to open up those shoulders. and then we're going to reverse. So as you're doing this, you can really be thinking about rolling kind of behind your sit bones and then up on top of your sit bones, behind your sit bones, and then up on top of your sit bones. This is also a really great way to check if you're sort of sitting in a neutral position. Because really, if you're sitting in a neutral position, you should be sort of halfway in between that. So if you're sitting at your desk and you find yourself that you're very arched and you have a really long way to slouch, you probably could come back a little bit. On the flip side, if you're really slouched, you probably could come up into this extended position a little bit more. Okay, the next one is just a seated thoracic rotation. So back to our rotation. One of the things that I cue people on with this a lot, I'm sorry, I'm talking really fast. I always talk really fast. One thing I cue people on with this a lot is we need you to really sit up nice and tall. You're thinking you have a really long spine before you start twisting. So give yourself as much space as you can. Then you're gonna put your hand behind you, your other hand on your knee, and you're gonna twist it to the left, and then you're gonna twist to the right. But for this direction, every time you're here, now what you can do is you can take deep breaths in, extend up your spine, and then as you exhale, twist farther. I like to think of my front hand as being the one that's helping with my rotation, and my back hand as being the one that's helping to lengthen my spine. Again, there's a very good chance that you're going to be very asymmetrical in these, and that's okay. This is another one too. With the deep mobility exercises, don't go whipping from side to side. You're going to do a couple on one side, come back to neutral, let your spine neutralize, and then go to the other side. The flexion extensions are a little bit more forgiving in terms of like doing repetitions, but I don't like people whipping their whole spine back and forth in rotation. Okay, the next one that we're doing is a sort of if you've ever had cervical spine, and you talked to me about Mackenzie cervical spine sort of things, this is great for people that have forward head position. So like we said, in forward head position, we're at a desk. We have a really extended low spine. A really flexed low spine as your head comes forward, and then a really extended upper spine. So what we're gonna do is we're trying to exactly reverse that. So Scott's gonna sit up nice and tall. He's actually gonna use his hand and his chin to guide him. He's gonna retract his head straight back. So one thing we always look for is, are his eyes going straight back? He's not like tilting himself into extension, tilting himself into flexion while he does this. He's gonna come straight back. This is retraction. This is the first part of this move. If this is tough enough and you don't feel like you can get your ears back in line with your shoulder, this is where you stop. And that's perfectly okay, because retraction is the first part of this motion. The second part of this motion is you retract all the way and then you extend. So holding that retraction, he drops his head all the way back into extension. Good. The good thing about this is when you push your head back into retraction, you're really going to finally extend that lower spine, which in forward head position is really actually flexed all the time. So we're trying to sort of reverse that curve. This is great if you have neck pain. Also, this works really well like if you're having like stiffness in any direction in the neck. Try a couple of these. I will warn you, often the first couple are really hard. You're really stiff, they're really challenging, it feels really cranky. The rule for these is do a couple, do them, to the best, to end range the best that you can. As long as it's not getting worse, that's probably a yellow or a green light. As long as the pain is sort of transitional and it's not getting worse during the movement, that's good. The last one we're going to do is literally just a generalized, it's like a neck roll, but I'm going to use the idea of like a controlled articular rotation. That's something to get into another day to do this. So we're going to do it in a pretty specific order. So for this, what I'm going to have Scott do is I'm going to have him flex his chin down to his chest, all the way down. From here, he's going to drop his ear over to his shoulder. Now from here, he's going to rotate so he's looking backwards over his shoulder. Then he's going to rotate up and around into extension so that he's going to look back over his other shoulder. Good. Then he's going to bring that ear to his shoulder. Good. And then he's going to move back into flexion. And then we're going to go all in the other direction. Ear, look over shoulder, extend all the way back up and around. He's got a little hitch in that spot. You see that? All the way up and around to the other spot. Good. back down, good, and then flex. A lot of people will have a little hitch in their range of motion. This is one of those, I actually do these all the time in the shower because I feel that if I'm in the shower and I have a lot of hot water and it's all the tissues are really warm, sometimes I'll be able to get through that little hitch a little bit better. If you have a hitch like that every single time you come through it, maybe you don't just go quite into as much extension, or you work the other direction a couple of times and then see if that will clear up. Okay, those are our demonstrations. Let me see if I may have a slide or two more to share with you guys. So share my screen, hide my mask again. So Scott can stay far away from me. Okay, so what we talked about is we demoed the self-releases, pecs, the lats with the foam roller, the quads with the foam roller, and then we did the hip flexor stretch, the pec stretch, the side bending, check, mat or floor work, and our seated mobility. Okay, this is a good question that people ask a lot, and Scott was smart to bring this up in our slides, is in terms of dosing, when and how much. Mobility can and should be done every day. And the most important thing, as with any routine, is to find a routine that works best for you. So do you wake up and feel stiff? Do these first thing in the morning, okay? But like I said earlier, like if you're doing them first thing in the morning, maybe you don't go to end range. Maybe you just do it within sort of a more available range of motion, and then it'll get you going through the day. If you have a long day working from home and you notice that your stiffness starts like towards the end of the day, do them at night before you get to bed. Like, if you notice you're having stiffness, like when you wake up in the middle of the night, do some mobility before bed. Feeling ambitious, you can do your mobility routine morning and night. We did give you some opportunities like in different positions. So certainly you could do some of these easy mat or floor work in bed in the morning, and then you could do some of the seated one when you're at your desk. That's entirely possible. One thing that's really important to remember is that postural changes throughout the day are key, at least every 60 minutes. And honestly, it could probably be less than that. You should try to stand up and move around. If you're doing it every 20 minutes, like even if you just get up for 20 seconds, like do a quick rotation, extension, move it sit back down. If you're doing it every hour, stand up, go get a glass of water, go to the restroom, like use that as an opportunity to really like just sort of get some motion in. There's a good quote from Joseph Pilates. If your spine is inflexibly stiff at 30, you are old. And if it is completely flexible at 60, you are young. I had a patient one time I will never forget. He told me, he said, I do daily mobility. And he said, it may not make me have more years, but it's definitely going to make me do more with my body during the years that I had. And that's always stuck to me. I think that's just like a great quote. Okay. Questions? I'm going to give you guys more information, then I'll go back for questions. So there are lots of releases and exercises available on our YouTube page. You just have to search for React Physical Therapy, and our homepage will contain all of our videos. If you have any more questions, we have answers. Like I said before, please come in for a free injury screen or consultation. We can do it in telehealth. We can do it in person. We are really good about COVID. We're always wearing masks. All of our patients are wearing masks. We're disinfecting all the time. So we are an essential business. We will stay open, and we want to make sure that you don't fall apart during COVID. It's been hard enough, so you don't have to have pain as well. We have offices in West Loop, River North, Lincoln Park, Lakeshore East, Wilmette, and Deerfield. This is my contact information. We're going to share this out after as a recap. So let me see if anyone has any questions. Stop my sharing. The question was, okay. There's a lot of questions. Sorry, I didn't get to these. The rotational stretches, when I do the open books, I usually do about 10 or 15 to each side. When I do the longer duration, like the supine, I usually say do 2 or 3 for 30 to 45 seconds. And the same thing with these seated thoracic rotations. If I'm really getting into them, I'll do 2 or 3, 30 to 45 seconds. That allows you to get into it, do 2 or 3 deep breaths, and get to the end of it. We will definitely send you the recording to remember it. We will provide you a list of all the moves after the webinar wraps up. I actually made a little like video that I'll give you guys, so you can follow through. It's just a quick demonstration of everything. We are open in all of our locations, Monday through Friday. A couple of the locations, particularly the West Loop, is open on Saturday as well. We have hours 7 to 7 most days. Fridays we do close a little bit early, but we're also open for telehealth pretty much 7 to 7 every single day. So, okay, I think that's all I have. Scott, do you have any final words of wisdom for our?
I do not, but I will say that this is stuff that I do myself. And as Missy was saying, we were demonstrating beforehand, I have a lot of problems in the way I was moving. I have the hitch in my neck. So this is stuff that I will be doing every single day and continue to do. And that's why we recommend it, because it really is so important.
Okay. Great job. Thanks, guys. Send me an email if you guys need anything. I will add that at the bottom of my little link. So, okay.